Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the thiazide diuretics and related agents. The thiazide diuretics are the chlorothiazide, hydrochlorothiazide, okay. We have also some related agents which are structurally different from that of the thiazide diuretics, but their functions like that of the thiazide diuretics, even sometimes better than that of the thiazide diuretics. These are the chlorothalidone. These are the chlorothalidone. Okay, one is chlorothalidone, another is indipamide. Okay, so chlorothalidone, indipamide, and metolazone Okay, these are the related agents. They contain closely the structural configuration with that of the thiazide, and they are different structurally, but they work like that of thiazide. Okay, so we'll go to the mechanism of action of the thiazide. Mechanism of actions of the thiazide. If we go to the kidney, we have kidney, and each kidney has about 1 million to 4 million nephron, the unit of the kidney. So we have the proximal convoluted tubule, okay, proximal convoluted tubule, the descending limb of the loop of Henle, thin segment. We have also thick segment, okay, loop of Henle. Then we have the distal convoluted tubule. Then we have the collecting tubule, okay. This is the Bowman's capsule, okay. This is the proximal convoluted tubule. This is the distal convoluted tubule. This is the collecting duct, and this is the loop of Henle. Proximal, this is the Bowman's capsule. And we'll get the glomerulus here, efferent vessel here. So this is the fundamental structure of a nephron. This is not straight convoluted tubule, it should be convoluted. You can make it a little bit convoluted here, okay, convoluted tubule. This is also convoluted tubule, and these we have around 1 million nephron inside the kidney, maybe 2, 3, even 4 million. Okay, so the site of action of thiazide diuretic is distal convoluted tubule. You must remember that. Site of action is in the distal convoluted tubule. Mostly, it also works partly very small action in the proximal convoluted tubule, but mostly in the distal convoluted tubule of the nephron. Okay, so this is the site of action. site of action of the thiazide diuretics. Okay, if you look at that tubule, this is the lumen of the tubule, this is the luminal surface, this is the epithelium, and this surface on the interstitium on the blood here. This is the luminal surface, the lumen is here, the luminal surface is here. Okay, this is the other side here, this is the basolateral surface, that is towards the interstitium and blood vessels. Okay, we got the site of action of the distal convoluted tubule. So we must know the mechanism of action. What is the mechanism of action of the thiazide diuretics? So this is an epithelium of the distal convoluted tubule, the luminal surface, basolateral surface. Most important point is here is sodium chloride co-transport. Okay, so thiazide diuretic, diuretic means that something increases the amount of urine. Thiazide diuretic blocks the sodium and chloride co-transport mechanism, co-transport system. Okay, so here is the sodium chloride co-transport system. So sodium and chloride cannot get inside the cell. Okay, so sodium and chloride cannot get inside the cell because this is blocked. This is blocked by whom? By the thiazide. Thiazide block this part. Thiazide and related agents that block the sodium chloride co-transport system, also called NCC. Okay, sodium and chloride co-transport system is blocked, but thiazide help to enter the calcium inside the cell. Okay, so it helps the entry of calcium inside the cell, inside the cell. Cell means the distal convoluted tubular epithelial cell. Okay, so calcium is getting in. Calcium is getting in also by the action of the parathyroid hormone. We have receptor on the basolateral surface for the parathyroid hormone that also pull the calcium outside in. So calcium is held by thiazide. Calcium is also held by the parathyroid hormone. Okay, we got that. On the basolateral surface, sodium, what is present here, getting out, potassium get in, but potassium does not exchange from the luminal surface of the distal convoluted tubule. Potassium should go down, and potassium is exchanged for sodium in the collecting duct. Okay, what happens here also? So calcium getting in there, calcium getting out, sodium is because sodium is getting out, sodium is getting in again. Okay, we got that. And also we have the hydrogen ion is getting in here. Hydrogen ion is getting in here. Okay, so eventually we may have the metabolic alkalosis because we are losing hydrogen. So again, sodium chloride cannot get in. Sodium chloride is going through the lumen. Calcium is getting in. So calcium will go to the blood. Okay, potassium should not be exchanged at this level, but potassium is exchanged in the collecting duct, and that also need the aldosterone. Okay, and also exchange between sodium and potassium in the collecting duct. Okay, we got the mechanism of action of the thiazide diuretic. Okay, now how it works? Thiazide diuretic, one of the most important therapeutic use to decrease the hypertension. So it is an anti-hypertensive agent. How it works? So we'll go to the actions. Okay, what are the actions are done by the thiazide diuretic and related agents? Number one, it increases excretion of sodium and chloride. Increase excretion of sodium and excretion of sodium and chloride. How? By blocking the sodium chloride co-transport mechanism here. Okay, this is one action. One. Number two, what is the second action? It loses potassium. Okay, it loses potassium. So loss potassium. Potassium from where? It lost potassium from the collecting duct. Okay, then loss magnesium. Loss magnesium. How it loses magnesium? We don't know exactly. The exact mechanism of action is not known. And also decrease urinary calcium excretion. Decrease urinary calcium excretion. How? This is the way it helps to get the calcium inside the cell. Calcium is also pulled inside by the parathyroid hormone. Okay, so decrease urinary calcium excretion. Okay, then reduce blood volume, because it is a diuretic, and very important, it decreases peripheral resistance. That is very important. Okay, we got the actions of the thiazide diuretic. Number one, increase the excretion of sodium and chloride. Okay, it loses potassium from the distal convoluted tubule, loses magnesium. Potassium is lost during exchange of sodium and potassium not in the distal convoluted tubule, in the collecting duct. Okay, exchange of sodium and potassium, and also the loss is also done by the aldosterone hormone coming from the adrenal cortex. Okay, loss of magnesium, decrease of urinary calcium, decrease of urinary calcium excretion, reduce blood volume, and peripheral resistance. These are the actions of the thiazide diuretic. We got the actions. Okay, now we go to find out the therapeutic use of the thiazide diuretics. Therapeutic use. Therapeutic indications. Okay, so therapeutic indication, it is an anti-hypertensive drug. So it is used in hypertension. It is used to reduce edema, especially in case of cirrhosis of liver, renal failure. Okay, so to decrease edema, generalized edema, like liver cirrhosis, renal failure, or on any other region. It is one of the indication. It is a management for heart failure. In heart failure, that is also edema. Heart failure, management of heart failure, and the management of nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus. Okay, so we got that. So again, therapeutic indication. It is an antihypertensive drug. It decreases edema due to heart failure, edema due to cirrhosis of liver, edema due to any other condition that like that of the renal failure. Okay, so nephrogenic diabetes insipidus, not the neurogenic. It is nephrogenic diabetes insipidus. Okay, so there is an indication of the thiazide diuretics and the related agents. We got that. But you have to remember that to manage hypertension, this drug takes couple of weeks, maybe 1 to 3 weeks, to be effective in the control of hypertension. To decrease the blood pressure, it takes 1 to 3 weeks time. Okay, we got the therapeutic application of the diuretics. Okay, now we'll find out the adverse effects. Adverse effects or side effects. Adverse effects. If we go to the mode of action, we have adverse effects. Okay, like that of it will cause hypokalemia, because it decreases the potassium through the collecting duct or collecting tubule by exchange with that of the sodium, and also by the action of the aldosterone. Okay, it causes metabolic alkalosis. Okay, how? Because we are losing the hydrogen. Okay, so that will cause metabolic alkalosis. It may cause hypercalcemia because of absorption of calcium. It may not be very severe, but sometimes that hypercalcemia may mask the other causes of hypercalcemia, like that of hyperparathyroidism, sarcoidosis, or cancer. In those conditions, there is hypercalcemia. This may even add the hypercalcemia. It may mask the hypercalcemia of other causes. Okay, so we got that. And one of the important point is that because it is a diuretic, it will cause hypotension. Okay, and blood volume depletion may lead to orthostatic hypotension, but it is not an usual complication, especially in the young individual. Very old person may have orthostatic hypotension, okay, due to volume depletion. Okay, it may cause hyperglycemia. This is very important. How it causes hyperglycemia? It causes hyperglycemia by suppression of the beta cells of the islets of Langerhans of the pancreas. So insulin will not be secreted properly. It also prevents the action of the other anti-diabetic drug like sulfonamides. Okay, so sulfonylureas. So that it may cause hyperglycemia by suppressing the anti-diabetic drug, by suppressing the insulin. Okay, we got that. It may lead to gout. This is very important. It may cause gout. How it causes gout? Because it prevents the excretion of the uric acid, because we know that the thiazide diuretics are ligands. they are attached to the organic acid system of the nephron. So they compete with the uric acid for excretion. So there will be high uric acid, and that uric acid will be deposited in the bone, especially the first metatarsophalangeal bone, common site, maybe the knee joint or first metatarsophalangeal joint or the knee joint or any other joint, may lead to gout due to the adverse effects of thiazide diuretics. We got that. Then it may lead to hyperlipidemia, maybe 10 to 15% serum cholesterol level may be increased. Hyperlipidemia. Okay. We got the adverse effects of the thiazide and related drugs. Okay. So hypokalemia, how to manage hypokalemia, will always assess the serum level of the electrolytes, the potassium. Also, we may add the potassium rich food like that of the prune, maybe the citrus fruit, or maybe the banana or green coconut water. Maybe use some type of potassium sparing diuretics like spironolactone or trimethoprim. We may add that. Okay. So that is managed in that way. Okay. So this is the way. A gout, we may avoid the condition that causes gout, or gout causing diet should be avoided. Okay, that is the way to manage the adverse effects. So we got the adverse effects. Now we'll go to the pharmacokinetics. This drug is absorbed through the intestine very easily, and it has long half-life. That half-life is variable from drug to drug, and if we increase the dose of the drug, it will not cause additional efficacy. So these are also called ceiling diuretics. So those increment may not increase the efficacy. Okay. We got that. So pharmacokinetic is absorbed through the intestine. It is excreted by means of the urine and maybe by the liver. Okay, like all other drugs, so mostly by the urine, metabolized in the liver. So this is the pharmacokinetics, and its half-life is very long half-life. Half-life is variable, especially pharmacokinetics will get better pharmacokinetics with the thiazide related agents. Okay, that's very good. Now we go to the drug interactions. This is very important. Drug interactions. Okay. This drug is dependent on the prostaglandin, so its action may be altered due to the presence of NSAID, or even by the Tylenol, which suppresses prostaglandin, may not go nicely with that of the diuretics. Okay. So NSAID may alter the efficacy of the diuretics. Another one is probenecid. Okay. Probenecid. This is a medication that is an uricosuric drug. It releases the uric acid through the urine. So this will alter the action of the thiazide diuretic. So probenecid has drug interaction with that of the thiazide diuretics. Okay. Cardiac glycoside, like that of digoxin or digoxin. Okay. So this drug thiazide causes hypokalemia. So along with digoxin or digoxin, what will happen in cardiac glycoside? There may be toxicity, adverse effect of this drug will be manifested. Okay, very, very important. Lithium, another medication. Lithium is used in bipolar disorder that has also interaction with that of the thiazide diuretics. Okay, so with the loop diuretics, so if you give loop diuretic plus the thiazide diuretic, there may be more effective diuretic function, but there may be ototoxicity. That is a possibility. Okay, ototoxicity, like that digoxin will be toxic, more adverse effect due to the hypokalemia. Also, in a patient who take the medication like that of the anti-diabetic drug insulin and anti-diabetic drug, in that condition there may be more hyperglycemia. Okay, so these are the adverse effect and also the drug interactions that is very important to us. NSAID, probenecid, okay, the cardiac glycoside, lithium, loop diuretics, insulin and anti-diabetic agents. And that's all about the pharmacology of the thiazide diuretics and related drugs. If you like my video, please support my channel, please subscribe me, share the information with your friends, and have a nice day. Bye now.